This is FX Medicine. I'm Andrew Whitfield Cook, and we're at the United in Compassion 2017 conference in Melbourne, and I'm with Deepak Anand. Deepak, can you please take us through first a little bit about your qualifications?
Sure. So I've been involved in the pharmaceutical industry for about 15 years. I worked as a quality assurance person, a QP with Health Canada for that amount of time. Traditionally been involved in pharmaceutical drugs for several years. And then I got involved in the medical cannabis industry about 3 years ago when Health Canada came out with their program, Legal Cannabis, Medical Cannabis, and helped them guide to the process of sort of legalizing cannabis for medical purposes and now for recreational purposes.
So that's rather different in that it's not just medical but recreational purposes.
Correct.
Can you take us through why? Why
Sure.
are they looking at recreational use?
Sure. So if you look at Canada, our health minister has been on record saying that the crisis on drugs has sort of not been helpful. It's a huge epidemic in Canada. We've got opiate deaths by the thousands now. So the government's realizing that the war on drugs just simply hasn't worked. They realize that cannabis is a product that has got relatively low harms, and it was a campaign promise that our Liberal government made about a year and a half ago to legalize cannabis for recreational purposes, and they're delivering on that promise.
What about the old adage that cannabis is a gateway drug? Weren't they concerned about that?
Yeah, well, it certainly was a concern. In fact, since we've had a medical program for about 3 years in Canada, we've had the benefit of looking at sort of people getting off of opiates and using cannabis as a step-down drug, not a gateway drug. So from that perspective, it's been significant in terms of the research that we've done to understand people getting off of opioids using cannabis as a step-down drug. So we've seen that research on the medical side, and we've had the fortunate privilege to work with countries like Uruguay and the Netherlands that have got somewhat quasi-legal programs in their jurisdictions. Uruguay has fully legalized all drugs for recreational purposes, and they found that consumption of drugs actually went down, illegal drugs that is, went down significantly once they legalized it. And you look at, we've again been fortunate to look at states like Colorado and Washington State in the US where they've legalized cannabis for recreational purposes, and they've found the same, the consumption's actually gone down off all drugs.
Of all drugs?
Yeah.
All illicit drugs?
All illicit drugs, yes.
Right. So with regards to the naysayers of the use of cannabis for even medicinal purposes, being concerned about a rise in crime. I remember the Colorado experience, yes. Portugal.
Yes.
How's this played out around the world? Why is there still concerns about a rise in crime?
Traditionally cannabis has been something that's been heavily targeted by the pharmaceutical industry for many years as being this negative drug. It's had a huge racist connotation to it in terms of the whole racism theory, and I think that really hasn't helped. I think a lot of the stuff that you're seeing in the media is, isn't really simply not true. Because there is a lot of myths around cannabis and increase of crime, and it's just simply unsubstantiated.
What about the shift? When did the shift occur, and what sort of hurdles were encountered when the government said, okay, let's do this, let's move forward?
So basically our medical cannabis program evolved. It's interesting to see Bill Turner this morning talk about how you guys got here and where you're going and some of the frustrations. When I look back at our cannabis industry, we've had significant challenges. Patients spent close to 8 years in court to get access to this and to get the government to actually even look at implementing a program.
Wow.
And that program was far from perfect. And they spent another 4 years trying to actually get the program to be perfect as where it's at right now as far as our medical cannabis program is concerned. So the journey has been difficult. We've had the same issue of physicians having issues prescribing, trying to get peer-reviewed literature to physicians to help them understand what cannabis is about. The fact that our CMA, which is our Canadian Medical Association, which is like your AMA, has not been supportive of this. They've been completely against it. They still are completely against it.
Right.
So some of the challenge that we face on legalization is predominantly the CMA. I think age of access for us is becoming a huge issue. The government campaigned on a promise that they were going to take this out of the hands of criminals, and they were going to make sure that we've got low consumption of underage access of cannabis. Canada is the largest country that we've got the most number of youth accessing cannabis anywhere in the world. that is youth being people under 18, between 12 and 18. So we've got one of the highest rates of consumption of cannabis in that youth market, and the government wants to take that out of the hands of sort of youth as well. And so that's the pretext in which our framework is developed on legalizing cannabis for recreational purposes.
And so with regards to effects, is the Canadian government collecting data on adverse events from the use of cannabis?
Absolutely. So our ACMPR, which is our access to cannabis for medical purposes regulations, have a mandatory reporting line where patients are required to call in and report any side effects to the licensed producer and to Health Canada. So there's provisions and there's data in there that the government's actively collecting to make sure that this is done correctly. I think the biggest thing that we've done very well is we've got a safe and quality product. The government's spent a lot of time painstakingly actually putting together a program that's free of pesticides, making sure that there's no mold, mildew, any of the other harmful ingestants that patients are going to be consuming this drug for. And it's good to see that they're using the same framework on the legalization model. So it isn't going to be different. A recreational product is going to be the same as a medical product.
I just went blank in the brain. So with regards to the regulatory framework differences or similarities between Canada and Australia, they're said to be quite similar. You heard Bill Turner speaking this morning from the Office of Drug Control.
Yes.
So why do you think there's such a disparate approach by the government?
So I think there's two differences here. I think Bill Turner is with the ODC, and they're primarily responsible for cultivation, making sure that manufacturers are in line, the cultivation research licenses are in line, and I think they've done a good, in fact, a better job than what we've done in Canada, learning from the Canadian examples. I think that the fact that prescribing rests with the TGA is a bit of an issue. In Canada, as an example, we don't have that. We've got provincial colleges, which is our state governments. That's the College of Physicians and Surgeons that govern physicians. And they've sort of said, here's guidelines around the federal framework. Go out and prescribe and we'll see what happens. So they've taken a cautious but optimistic approach on it, whereas I think the TGA and physicians mainly have had a hard time. It's good to see groups like OzCan getting physicians from Canada. They just got Dr. Daniel Schechter here multiple times to do some conferences and lectures around how he's prescribing cannabis, and he's been a leading cannabis prescriber in Canada for several years. Bedrocan, another of our Canadian companies, came down and did a masterclass to physicians on cannabis access. They've been providing cannabis for close to 15 years in the Netherlands, and they've brought that experience to Canada, and they're doing the same here. And I think the more that Australia learns from countries like the Netherlands and us in Canada, I think that knowledge, particularly for physicians, is very important.
So the last question. So you've got the government supporting cannabis, you've got the GPs prescribing cannabis, but the medical association is against it.
Yep.
Don't they feel like a little bit of a sandwich?
There's definitely that issue. Having your CMA or your regulatory body against it is never easy, particularly for physicians. But I think that's changing. I think with us particularly legalizing cannabis for recreational purposes, it's going to make physicians a lot more comfortable even in prescribing medical cannabis because they see the harms are relatively low of cannabis consumption. So lots to look forward to.
Deepak, Anand, thank you very much for your time today on FX Medicine.
Thank you very much.
This is FX Medicine. I'm Andrew Whitfield Cook.